take the lead bite.
Every time you ask for the implant, we talk. Publisher in the field. Hello.
My name is Dr. Timothy Juwono. I'm a fifth-year urology resident at the University of South Florida in Tampa, Florida, USA. The training has been great. I'm actually about to complete my training in about 1 month, and so the total amount of penile prosthesis that I've done with him is well over 100. We're one of the largest centers in the eastern United States, which is good, but it is good to see other ways of doing it and other tips and tricks from other providers such as Dr.Park. I'm joining a private practice group in Central Valley, California. It's a private practice group in the area that does every type of urology. Specifically for me, I have been hired to do a lot of the andrology and penile implant surgery as well, so it's going to be exciting to start that. Well, Korea is a great country. Seoul is an awesome city. Like I said, I have been here before, so I was able to do all the touristy stuff last time. I think at the end of your training, especially for me, it's good to see take every opportunity to see how other people practice in different countries and different parts of the United States. I actually shadowed Dr. Paul Perito in Miami. We did a course in Nashville, Tennessee with Boston Scientific, and so my colleagues and I that are about to finish, we're taking every opportunity we can to observe other ways people do it. We've done Dr. Carrion's way over and over again, but it's good to see how other people do it to be able to better ourselves. Plus, I wanted to see what a Korean clinic is like after watching so many Korean dramas. So from Dr. Carrion and Dr. Parker, they work closely with Dr. Park from the SMSNA, which is the Society for Andrology and in the United States. And he actually came to Miami, Florida a couple months ago to proctor at the SMSNA. I unfortunately wasn't there, but my really close colleague was and told me really great things. And so I was able to reach out to him through Dr. Carrion, and he was more than willing to have me come here today. So very appreciated. I think he has a great setup, from just being briefly here, having the same team, having the operating room, and the way his process is. It seems very streamlined, very meticulously planned out, which I think is a great benefit. And I hope to be in that setting one day, having the same team that knows exactly what we're doing, having a good setup that'll make the process smoother and better outcomes for the patients. A lot of old school providers around the country in the United States, they have that setup, which is something that you always want to strive for. So I think he's got a great thing going here. Subcoronal approach, the way he does it is I think he has a very streamlined process. In medicine, especially in surgery, you want to do what you're good at, but you also want to be able to get yourself out of a situation, because not all surgeries are the same, not every patient is the same. I think being able to do the subcoronal, penoscrotal, infrapubic, all the things he was mentioning in the OR as well, it's good to have in your back pocket. I think this approach for his patient population is good. He was telling me about the postoperative pain, the postoperative early pump manipulation. All of those things are discussed in the penile prosthesis world. And I think he's thought about them and has a good way of doing it that works for him. In 10 years, I think it's going to depend on how the US healthcare market evolves. Obviously, there are a lot of people in the penile prosthesis circle that Dr. Park knows and that Dr. Carrion knows, that they've been able to mold their practice to solely doing andrology or penile prosthesis surgery. I think that if you're able to get that patient population and it's something that you love to do and it makes your patients happy, that's definitely somewhere where I'd like to be. I do like other parts of urology as well though, so I may not be willing to give that up, but I'm not starting practice for another month, so we'll see. Ask me again in 5 years.